All right, so today we're going to do a few more skills for you. We're going to start out with joint splinting. Of course, you know, joint splinting could be a lot of different joints. It could be your ankle, your knee, your elbow, your wrist. Just to keep it simple, we're going to go over basically just your ankle. So we're going to just show you how to do a joint splint of the ankle. This could be one of your National Registry skills. It's one of the randoms. So I will go in line according to what National Registry would have you do. All right, so this is going to be our joint splinting station. We're going to be using the ankle as our joint. I will use the National Registry check sheet as I go through this. Of course, we have our BSI on. We've made sure that the scene is safe. We come in, we know that we have an injury to the ankle, so that's the only thing we're going to concern ourselves with. So when we first come in and make contact with the patient, I'd have my partner hold and maintain stabilization of the injured extremity. And basically what you're doing with this is you're just trying to make sure that there's no excess movement. Once she does that, I am going to assess for pulse motor sensory, checking for a pulse. Ma'am, can you feel me touching you? Can you wiggle your toes? Okay, so we have positive pulse motor sensory. Depending on when you're talking about an ankle injury, as we are here with a joint, you may or may not put an ankle hitch on, depends on what is going on. So if the ankle's bent at a funny angle, obviously you're not going to worry about position of function. But we're going to pretend like this ankle is straight, just has a small injury to it. So with that, I will just put a very not too tight ankle hitch to kind of keep the foot in the position of function. Now, when it comes to splinting with an ankle in particular, there's no exact. You could use padded boards, you could use SAM splints. Sometimes what is ideal is just something that is kind of soft and bulky. So you could use a trauma pad, you could use pillows. I like pillows with polka dots. There's nothing wrong with that. So that's what we're going to use right here today. What you basically want to do is have your partner lift the leg slightly so you can set the extremity in the center, and then you are going to make it into a nice little comfy burrito. Now, you want to take 2 cravats. Why 2? Because you always got to have 2. I'm just going to slide them up underneath before I start tying. Essentially, you always want to make sure that you splint above and below the joint of injury. When you're talking about an ankle, that's a little bit more difficult. That's why you do the ankle hitch if it's possible. Then with this pillow, I'm just going to make 2 simple overhand knots, making it nice and snug. Then you want to make sure that you tuck all of your excess out of the way so that you don't get that caught on something. Now, once you have that done, you go back, you reassess pulse motor sensory. Can you feel me touching you? Can you move your, there you go, moving your toes nicely. Now at this point, you would just load your patient, transport to the hospital.